what I discovered when I was doing my research for Hormone Heresy was that the basic understanding of who we are as women is totally skewed. It's totally upside down. And there is a basic belief that goes back 2,500 years ago from the time of Hippocrates. In fact, he's quoted as saying, "What is woman?" He asked the rhetorical question, and his answer was disease. So we need to understand the profound impact of that belief system that basically perceived women as innately flawed, that our female physiology makes us deficient. It's like we start out life as a female already at a disadvantage. And it's really fueled a whole perception of how women have been perceived and treated for thousands of years. Thousands of years. And in Hormone Heresy, I actually spend a bit of time in the book looking at the historical perspective, because without history, we really have a hard time of understanding what's going on. So women were told that their vagina, their uterus, their ovaries were all impaired. And by the way, there's a movie coming out July 12th. Have you seen the previews for that, called Hysteria? Hysteria comes from the Greek word meaning uterus. And this is it's a romantic comedy, but it's a true story about the history of vibrators. So, you know, this is coming out, it's true. And the history of so you know what the history of vibrators is about? No. In the Victorian era, there was a doctor who created the first prototype of the vibrator, and they believed that Victorian women were really unhappy and depressed and stressed because they were just frustrated, sexually frustrated. So he created a device to relieve them of their frustration, a medical device. And they would go to him lining up along the streets to be relieved of their depression and stress, and they'd walk out very happy. And that is the first vibrator. And that movie that's coming out July 12th is all about that period of history. So I think everyone should go and watch that movie, and it'll be fun. So anyway, so we've been taught that we really need some sort of intervention to help us, because our hormones innately deprive us of our sanity and our health and well-being. And the initiation of hormones in 1960 with the pill was the beginning of this belief that hormones were really going to liberate us. So in 1960, that's the time that the pill arrived on the scene. Now, when we were given the pill in the 1960s, we were part of a massive experiment because we really didn't know what these hormones were going to do. Well, that's not true, because actually since the 1930s, it was known that estrogen is a carcinogenic drug. We didn't know that, but somehow that bit of fact got overlooked because they were looking for a contraceptive device. So we were given massive amounts of estrogen and progestin on the pill in 1960, huge amounts. And as a result, women were actually falling over dead of blood clots, strokes, and heart attacks. So that's how the low-dose pill came in. You know the term low-dose pill? You know, it sounds very innocuous. Low-dose pill, just a little bit, it's not so bad, right? But the low-dose pill means it's lower than this excessive high dose that had such dramatic health consequences to women. So we just need to know a few things about the pill, and one of those things we need to understand is that the pill mimics what process in our body? What is the pill designed to do? Pregnancy. And it's the time when we're making the highest amount of these hormones, estrogen and progesterone. So there's no such thing as a low-dose pill. It's just lower than the excessive high dose that was so damaging to women. It still has to be high enough to shut off the ovaries, or as the medical term is, chemically castrate women. That's what the pill does, chemically castrate. So anyway, in the 1960s, the pill came in. It was the first introduction of these synthetic hormones. And then in 1966, it was followed by the introduction of estrogen for menopausal women. And it was introduced by a doctor named Dr. Robert Wilson. Dr. Robert Wilson was a big shot professor. We know how we always trust all those big shot professors. He was a big shot professor. He was the president of the American Association of Obstetrics and Gynecology, very prestigious position. He did some study for 1 year, and his study was the basis of his book called Feminine Forever. And basically what he said in Feminine Forever, a runaway bestseller, by the way, was that the menopausal woman becomes the equivalent of a eunuch. She is a caricature of her former self, and it's a time of decay and decrepitude. Other than that, he didn't really, you know, he really liked women. And he was going to save us. He was going to save us from this hell of living decay, which is menopause. You know, here we are, examples of menopausal women. And his solution was estrogen replacement therapy. And he said it was going to keep women young and juicy and their skin wrinkle-free. And do you think we bought it? Yes. Hook, line, and sinker. You know, thousands of women rush to their doctors. He was a best-selling author. He started the era of hormone replacement for women. And his research is still written up in medical textbooks. And that came to a screeching halt in 1976. Book came out in 66. 10 years later, 2 studies came out simultaneously, and they basically reported why there was an 800% increase in uterine cancer in the previous 10 years. And the only known reason for uterine cancer to this day is from exposure to too much estrogen. So he was giving estrogen to women with uteruses, without uteruses. Everybody got estrogen. And then they went, oh my God, it's all these women were dying from, were diagnosed with uterine cancer. You know what the treatment for uterine cancer is? It's a hysterectomy. So all these women lost their uteruses, many of them lost their lives, and they went, oh gosh, made a mistake. A little postscript about Dr. Robert Wilson. The FDA discredited his 1 study. He himself was discredited as a credible researcher, and he became a very wealthy man because he had a trust fund set up in his name, donated to by the 3 leading manufacturers of guess what? Right? And he made over $1 million. So it's good to remember a bit of history because we are repeating history all the time unless we know what's going on. So as an example, when I wrote my book, Hormone Heresy, in 1996, it was the height of HRT. So hormone replacement therapy was the panacea for women. It was going to protect their hearts, protect their bones, stop them from having these terrible hot flushes. It was protecting their brains, and it was like the youthful pill, HRT. Which, by the way, when estrogen went out of favor because it was killing all these women, the drug companies regrouped, said, oh God, we made a terrible mistake, we're so sorry. No class action suits in those days. They said, we forgot to add progesterone, just like the body does. Oops, back to the drawing board. 10 years later, it came back out. Now it had synthetic progestin, which is a totally different action than what the body's own progesterone makes, added some estrogen, and they had to create a new disease. And the new disease was osteoporosis. And did we buy it hook, line, and sinker? Yes, we went back on it. We forgot. We forgot that estrogen and synthetic progestins are listed as known human carcinogens. And we can throw in tamoxifen as a known human carcinogen, the #1 drug given to women to prevent recurrence of breast cancer. So, so where was I in the story? So, oh yeah, so HRT was this new panacea. Then in 2002, the Women's Health Initiative came along, and that was the first long-term study ever done to test the efficacy and safety of HRT on women. I mean, that's 1992. It's been used since 1960, no long-term studies, really? So this major study was cut short by 3 years because they found that women on HRT were getting breast cancer and blood clot strokes and heart attacks and you know, some serious problems. So here we are, fast forward 2012, and what was the big announcement in May of this year? Anyone listen to Today Tonight? Papers? No? You don't read the papers, good for you. Anyway, big announcement. I don't know if it was the Australian Medical Association or the Menopause Society. I'm not sure who it was, but there was a big announcement that said, oh, the data from that Women's Health Initiative was flawed. HRT did not cause breast cancer and strokes and blood clots. The population was older. They already, I don't know, whatever their story was about it. And it's okay to use HRT. And all those poor women for the past 10 years who've been so deprived, having to suffer with hot flushes. You know, we feel so badly for that generation. But now it's in. So HRT is in. A week later in the United States, the Annals of Internal Medicine came out with a major study and finding advising doctors not to use HRT for women patients because the health risks were too great. No wonder we're crazy. You know, we're all schizophrenic here. What's going on? Who do you believe? Who do you believe? It's always a challenge. Who do you believe? Well, you got to do some research. And I say to women, it's not enough to ask questions to your doctors. You better have a good grasp of the subject you're talking about, because if you don't know the answers, then you'll be given double speak, and you know, you won't walk out with the kind of information you need. So, you know, the truth is that estrogen progestins are known human carcinogens. And if you think bioidentical hormones are like the organic vitamin version of HRT and good for you, you better think again, because unless you truly need estrogen particularly, and truly need it, and generally you have to be really thin unless you've had a hysterectomy and that's an occasion for it, then the likelihood is that you're making plenty of estrogen, more than you need, especially if you have extra weight on, and that unless you get tested by the only accurate way to assess your hormones, which is the saliva testing approach, and every doctor you go to, and they want to check your hormones, they'll test you by doing what? Blood. It's the standard, you know, diagnostic test used for hormones, except it is wrong. It is flawed. It's testing the metabolites. Any good integrative medical doctor worth their salt will only use saliva testing as an accurate way to assess hormones. It'll test the true measure of hormones in your tissues. Because if you operate out of the belief system, and this is part of the myth, that at menopause, like Dr. Wilson said, the ovaries give up the ghost, and you run out of estrogen, and then therefore the savior comes by taking these hormones, you're going to be put on these drugs. Because you think, oh my God, I'm running out of it. But here's the truth. The truth is, first of all, the definition of menopause is 12 complete months without a menstrual cycle, okay? If you have not gone 12 complete months without a menstrual cycle, you're perimenopausal. And this is a time where there's more irregular communication between the, you know, pineal gland, pituitary gland, and the ovaries. There's this static going on. And so you're not ovulating regularly, you're not getting the messages. And also what's happening is the pituitary, because you're not ovulating as regularly, the pituitary is really trying to do its job, and it's screaming at that little ovary, you know, come on, girl, you can do it one more time. And as a result, what they found is that perimenopause is a time when you're making some of the highest amounts of estrogen your whole life. It's not a decline, because you know what? Our ovaries do not cease to function at menopause. They don't give up the ghost ever throughout our life. And this was astounding information to me. We reduce the amount of estrogen at menopausal years by 40 to 60%, because you know what? We're not meant to be bearing children in our 50s and 60s. Do we have any grandmothers here? Any grandmothers? You know, the great thing about being a grandmother is you get to play with the grandkids, you have a great time, and then what? You ship them off, right? It's like, no, it's me time. And not only that, when we are in our menopausal years, there is a shift that goes on. We do step into a level of intuitive wisdom and knowledge. And, you know, all the elders, you know, all cultures honor the elders because we do get wiser as we go into menopause on lots of levels. There are a lot of physiological shifts. There's a lot of spiritual shifts that happen in this cycle of our life. I mean, gosh, if you've had 60 years on life, you think you would have learned a little wisdom anyway. You know, your life experience would be distilled. But there are actually openings in the brain. There's more communication between the right and left hemisphere, so we just are more open on many levels. So what's happening at perimenopause is that we are producing some really high levels of estrogen, but we're not ovulating as monthly, as regularly, and you must ovulate to make the other key hormone called progesterone, which is like this little partner to estrogen. Because estrogen left on its own will proliferate cell tissue growth. It also is pro-inflammatory in nature. So if in balance, it's good, but when it's out of balance, when it's in excess in relationship to progesterone, it starts causing problems, including proliferation of damaged tissue that turns out to be things like breast cancer. So perimenopause is a time of declining progesterone levels and higher levels of estrogen. We call it estrogen dominance or estrogen excess. So if you go to a doctor and you start going and complaining of your hot flushes and your night sweats and migraines and all these symptoms and you're in your late 40s, he'll go, oh my God, you know, you're going into menopause. And he'll say to you, you should go on hormones or the pill. Oh my God, higher amounts of hormones in the pill than an HRT. That's a disaster because in perimenopause, you already are dealing with high levels of estrogen. Why do they do that? Because the whole understanding of our female physiology is wrong by the medical profession. It's wrong. It's not declining estrogen levels, it's some of the highest levels of estrogen. The symptoms are not from the result of low levels of estrogen. The symptoms are the result of this imbalance going on with your hormones, high estrogen, high progesterone, and I kind of take it one step further because I like to get to the root cause of why those hormones are out of balance. And to cut to the chase, why those hormones really go out of balance at menopause. You know, your hormones are symptoms of underlying issues. They don't exist on their own separate from what's going on in your body. Do you understand that? A lot of people go, oh my God, menopause, I better strap in my, you know, seatbelt, I'm in for a ride. I don't know what's in store for me, but it's going to be pretty scary, so, you know, hang in there. So we expect these things to occur, and there's symptoms that the body is way out of balance. If you were healthy, you would transition symptom-free, and you wouldn't have period pains, and you wouldn't have PMS, and you wouldn't have endometriosis, and you wouldn't have polycystic ovarian syndrome, and you wouldn't have ovarian cysts if you were truly operating in a place of, you know, optimal nutrition and balance within you. So the big myth is that we are running out of estrogen. The symptoms are about estrogen deficiency. You go to your doctor, they give you a blood test, which is flawed. That's going to show you have low levels. When if you did a saliva test, it'll probably show you had high levels of estrogen. And then they prescribe you the wrong drug that now puts you at risk of some serious health problems, including things like breast cancer. So that's why it's so important to know the story.